Hello everyone! Welcome again to my YouTube channel. It's me, your nurse educator, na magbibigay na naman sa inyo ng panibagong kaalaman, new ideas, new information that can help you, yourself, your baby, as well as your family. So, today, I've chosen a good topic na very concerning sa mga nanays when it comes to baby care. Okay, I want to talk about measles, which is a type of an infectious disease na very common talaga, especially in Asian countries, dahil marami talagang outbreaks almost everywhere in Asian countries for measles. So, I want to talk about this conflicting information na natatanggap ng mga nanay when it comes to breastfeeding, as well as the isolation about these infectious diseases. Okay, number one, measles, mumps, rubella, they are very serious infectious diseases. Most commonly, measles, okay? It can really affect the baby's health as well as the mother's health, especially if the mom get infected with it. Normally, the moms would also have the symptoms. But the worst thing is, pag buntis ang nanay at hindi ito immune sa measles, meaning never pa siyang nagka-measles when she was young, never pa siyang may injection ng measles before she got pregnant. So, risky talaga yung pregnancy niya kung wala siyang immunity of measles, wala siyang injection ng measles, na makakakuha siya ng sakit na to. Pag buntis si nanay, at there comes a time na she got infected with this virus, the main concern there is kung gaano ka-severe or ka-mild yung effect doon sa fetus inside the mother's womb. Dahil measles can be transmitted through the placenta. Okay? Kasi doon kumukuha ng pagkain ang baby. Doon kumukuha yung lahat ng nutrients ang baby. So, it can be transmitted to the baby right away. Now, that's called transplacental transmission. Now, depende sa severity, malalaman sa doktor pag nagkuha ng mga blood sample, malalaman kung very severe talaga ang infection or risk doon sa baby. Now, if the baby had been exposed to the mother, let's say si mom nagkaroon ng measles bago pa siya manganak, okay? Paglabas ni baby, kasi na-expose na si baby when the baby comes out from the, of course, from the uterus. 14 days after doon sa paglabas ng exposure ni baby, malalaman talaga kung talagang may reaction si baby, nagkaka-rash ba si baby, or nagkaka-fever ba si baby. Malalaman yun, talagang minomonitor niya namin kung sakasakaling may exposure si baby doon sa moms. Now, when we as healthcare providers found out na si mom ay infected ng measles, right away talaga nire-recommend na kailangan bibigyan ng immunoglobulins, immunoglobulin, IG ang tawag noon, na bibigyan talaga si baby because of the exposure. Based on research sa mga nanay ngayon na concerned about breastfeeding, okay, there is since 2017, wala pang nalabas na research na ang measles na ipas doon sa breast milk or transmitted into the breast milk. None. Okay? May kanya-kanyang opinion ng mga doktor. may kasabihan na doctors knows best. So you still have to follow what's your doctor's advice, okay? So if the baby have been exposed to the mom na nagkakaroon ng measles, paglabas ng baby noon, may ibang mga doktor na sasabihin, we need to isolate the baby. Sometimes may take 3 days, 72 hours, isolate si baby. Walang contact doon sa mom, walang breastfeeding doon sa mom, just to prevent transmission to the baby, okay? Kung walang sintomas si baby. Now, normally, yung rash, kung ma-expose man si baby, normally the rashes will come around maybe 3 days after birth, kung talagang nahawa si baby. But in most healthcare setting, the doctors would say, we are going to isolate the baby until the mother's condition is stable. Kahit walang sintomas si baby, kailangan talagang stable si mom. And what's that stability means? Gaano katagal yung stability ni mom pag sinabing gano'n? Sometimes it may take 10 days. Sometimes it may take 14 days bago si mom pwedeng makipag-bonding sa baby. Na talagang dry na lahat ang mga rash, wala ng fever si mom, na totally talaga stable na si mom. Ganun din ang gagawin sa ibang mga doktor doon sa infection ng chickenpox. So the chickenpox is the same way. That's the same way how we get treated dito sa ibang bansa. It depends sa mga healthcare setting kung ano yung protocol nila. But based on research, again, I'm going to repeat it. Walang nakikitang contamination doon sa breast milk ng measles virus during the research, okay? So that means it's up to the healthcare provider kung kailan po pwedeng mag-breastfeed si baby. Now, during this period na mom cannot breastfeed, mom is isolated from the baby is too far away, cannot get skin to skin with the mom, so anong gagawin? Skin to skin for newborns is very important. Dahil gusto nila yan eh. They need to have cuddle. They need to have skin to skin. So either the dad would do skin to skin. Kailangan turuan nyo kung paano mag-skin to skin ni dad na walang shirt, talagang skin to skin with the baby, or any member of the family, older member of the family can do the skin to skin with the baby. Now, when it comes to yung mga gamit ni baby, kailangan talagang you sterilize it, okay? You sterilize it, making sure na, kasi airborne. We're talking about airborne, okay? Nakukuha ito sa coughing. So mag-ingat talaga if anyone in the family, lalo na kung may family members ka na may mga sakit, may mga chronic illness or mga immunocompromised person, mga member ng family niyo na may sakit na cancer o may iba't iba pang immunocompromised diseases, kailangan talagang mag-ingat when it comes to kung may pamilya kayo, member of family got measles or may kapitbahay kayong may measles, kailangan talagang mag-ingat because measles infection can severely cause death, to be honest. Okay? So, make sure, and it can also cause birth defect. Kung buntis ka at wala kang immunity doon sa measles, wala kang injections before, bago ka nag-pregnant, never kang nagkaroon ng measles when you're younger, so you're really high risk. So that's why they always do blood work bago ka magbuntis, kung talagang ang immune system mo is covered, is protected, okay? So, ang measles, may iwasan ang transmissions on how you spread it if you make sure you stay away from people who have measles, making sure kasi it's an airborne that you can get it through coughing, so it's in the air, so making sure that you avoid crowded places. Kung buntis ka ngayon, you avoid crowded places kasi talagang especially during summertime na talagang minsan nagpipeak ang transmission ng measles to either to children or even to adults. So, These are the information na kailangan talagang maging aware ang mga nanay or mga women, those women who planning to get pregnant, making sure that you know what's your immunization status. If you need a booster for measles, you need to communicate with your healthcare nurse dahil importante talaga yung measles immunization before you get pregnant. Never immunize measles when you're pregnant because it can affect your baby, okay? So that's why you need to do the prenatal check-up bago ka magbuntis na kailangan talagang up-to-date yung immunization mo. So I think this is one of the most common problem in our country na kailangan talagang awareness, kailangan talagang knowledge to make sure that the transmission will not pass to different members of the family, okay? Especially with babies, okay? If you have any comments, any questions, or any experience, please share, do your comments, and please don't forget to subscribe and like this video and share these videos to so many moms out there who needs information about what to do if they're having measles. Anong gagawin, lalo na when it comes to going to see the doctor, it's hard to get information right now, right away. So I'm happy to share this information to help you manage your health and your baby. So thanks again. I'll see you more in 2 or 3 days. There will be more videos, and please watch that and subscribe. Thanks again.